All right, everyone. Welcome back to all my listeners. This is episode 9 in season 14. Today is Wednesday, February 26th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, it's the very last Wednesday of this short month of February, short and sweet. So you know that this episode is going to really focus on my Newsworthy fraud, waste, and abuse highlights that I've been featuring at the end of each and every month for the past 4 years. So today is no different. I'm going to spotlight that in Newsworthy. And of course, in my Trusty tip, I'm going to be focusing on something that I've been auditing over a number of years, and I'm seeing it more and more when it comes to behavioral health types of services as well. So I really want to remind the audience, remind providers out there, coders, auditors, compliance professionals out there on drug toxicity monitoring when it comes to column 3 for risk management in our E&M coding. So we'll touch on that in Trusty Tip. And then, of course, I'm going to close out and round out today's episode with another remarkable quote on change by another fantastic artist, Andy Warhol. Today's episode is sponsored by HCPro. Are you new to coding or looking to sharpen your medical coding skills? Look no further than HCPro's Certified Coder Bootcamp Original, the ultimate training program for mastering ICD-10-CM, CPT, and HCPCS Level 2 coding. This intensive course is designed to help healthcare professionals like you to develop a strong foundation in coding principles and guidelines. So whether you're coding for professional services or in the hospital outpatient settings, this bootcamp has you covered. Now, you can gain 3 exclusive features if you attend this bootcamp. Number 1, you can gain comprehensive understanding of ICD-10-CM, CPT, and HCPCS Level 2 manuals. Second, you'll also gain hands-on practice with over 500 coding exercises, real-world application at its finest. And finally, third, you can also gain personalized instruction in small classroom sizes, ensuring that you get the attention that you need to succeed. Now, HCPro's next live in-person Certified Coder Bootcamp Original is being held in Charlotte, North Carolina, and it starts on Monday, March 17th, and it runs through Friday, March 21st. And of course, as a special thank you for tuning in, HCPro is going to be offering my audience 15% off of your registration for this bootcamp. So simply use the promo code SONAL15 at checkout on hcmarketplace.com. So don't wait too long because March is coming up in just a few more weeks. Take the first step towards coding confidence and career growth today. Remember that promo code SONAL15 and that will save you 15% on your registration. All right, you guys, let's get into it. So today's Newsworthy, the month's fraud, waste, and abuse cases. The month of February saw 31 cases as of the recording of this episode. So let's check out some of the cases that I'm spotlighting. Now, early February saw a man pleading guilty in connection with a $17 million Medicare hospice fraud and home health care fraud schemes. Now, this California man pleaded guilty to healthcare fraud, aggravated identity theft, and money laundering in connection with a years-long scheme to defraud Medicare of more than $17 million through sham hospice companies and his home health care company. Now, according to court documents, this man engaged in the scheme with others to operate a series of sham hospice companies. He, along with his co-schemers, impersonated the identities of foreign nationals to use as purported owners of these hospices, including using the identities to open bank accounts and sign property leases, and then submitted false and fraudulent claims to Medicare for hospice services that were not medically necessary and not even provided. Now, in submitting the false claims, he and his co-schemers also misappropriated the identifying information of doctors, claiming to Medicare that the doctors had determined hospice services were necessary, when in fact, the purported recipients of these hospice services were not terminally ill and had never requested nor ever received care from the sham hospices. So as a result of this scheme, Medicare paid the sham hospices nearly $16 million. The man personally received nearly $7 million of the proceeds from the fraud scheme, including more than $5.3 million in transfers to his personal and business bank accounts, which were laundered through a dozen shell and third-party bank accounts. He additionally admitted to wrongfully obtaining more than $1 million for his home health care agency through the fraudulent use of a doctor's name and identifying information in certifying Medicare beneficiaries for home health care, which he attempted to cover up by paying the doctor $11,000. Now, this man pleaded guilty to healthcare fraud, aggravated identity theft, and money laundering. He is scheduled to be sentenced and faces a mandatory penalty of 2 years in prison on the aggravated identity theft charge, a maximum penalty of 10 years in prison on the healthcare fraud charge, and a maximum penalty of 20 years in prison on the money laundering charge. A federal district court judge will determine any sentence after considering the U.S. sentencing guidelines and other statutory factors. Now, early February also saw a pharmacy LLC agreeing to resolve False Claims Act allegations of billing for drugs not dispensed. Now, this New Jersey pharmacy has agreed to pay $350,000 to resolve allegations that it violated the False Claims Act by knowingly billing a federal healthcare program for certain medications that it never dispensed. According to the contentions of the United States in the settlement agreement, the United States alleged that from January 1st, 2015 through February 27th, 2023, the pharmacy caused the submission of claims for reimbursement to the Medicare Part D program for certain drugs that were never dispensed to beneficiaries. The government contends that inventory records showed that the pharmacy did not purchase enough of these medications from wholesalers to fill the prescriptions billed to the federal health care program. The claims settled by this agreement are allegations only, and there has been no admission of liability. Moving on. Early February also saw a Louisiana doctor sentenced for illegally distributing over 1.8 million doses of opioids in a $5.4 million healthcare fraud scheme. Now, this Louisiana physician was sentenced to 87 months in prison for conspiring to illegally distribute over 1.8 million doses of Schedule II controlled substances, including oxycodone, hydrocodone, and morphine, and for defrauding healthcare benefit programs of more than $5.4 million. Now, according to court documents and evidence presented at trial, a physician owned and operated Medics Clinical Consultants. I'll just call them here Medics. Medics was a medical clinic that accepted cash payments from individuals seeking prescriptions for Schedule II controlled substances. The physician routinely ignored signs that individuals frequenting Medics were drug seeking or abusing the drugs prescribed. In 2015, the physician took a full-time job elsewhere, and although he was no longer physically present at the clinic, he pre-signed prescriptions, including for opioids and other controlled substances, to be distributed to individuals there whom he did not see nor examine. In 2016, he hired another practitioner who, at his direction, also pre-signed prescriptions to be distributed to individuals in exchange for cash deposited into a Medic's bank account. The evidence also demonstrated that the physician falsified patient records to cover up the scheme and to make it appear as though he was routinely examining the patients. With his knowledge, these individuals filled their prescriptions using their insurance benefits, thereby causing health care benefit programs, including Medicare, Medicaid, and Blue Cross Blue Shield of Louisiana, to be fraudulently billed for controlled substances that were prescribed without an appropriate patient examination or determination of medical necessity. On July 22, 2024, the physician was convicted by a jury in the Eastern District of Louisiana of one count of conspiracy to unlawfully distribute and dispense controlled substances. 4 counts of unlawfully distributing and dispensing controlled substances, 1 count of maintaining a drug-involved premise, and 1 count of conspiracy to commit healthcare fraud. Now, February also saw 4 pharmacists sentenced for roles in a $13 million Medicare, Medicaid, and private insurer fraud conspiracy. Here, 4 pharmacy owners have been sentenced for their roles in a conspiracy to commit healthcare fraud and wire fraud. 1 was sentenced to 10 years in prison, the 2nd to 7 years in prison, the 3rd to 2 years in prison, and the 4th pharmacist was sentenced to 5 years and 5 months in prison. According to court documents and evidence presented at trial, they billed Medicare, Medicaid, and Blue Cross Blue Shield of Michigan for prescription medications that they did not dispense at 5 pharmacies they owned and operated in the states of Michigan and Ohio. The defendants collectively caused over $13 million of loss to Medicare, Medicaid, and Blue Cross Blue Shield of Michigan. On September 5th, 2024, a federal jury convicted all 4 of conspiracy to commit healthcare fraud and wire fraud. Let's move on. February also saw a doctor convicted of a $24 million Medicare fraud scheme. Here, a New York doctor was found guilty by a federal jury for causing the submission of over $24 million in fraudulent claims to Medicare for medically unnecessary laboratory tests and orthotic braces. According to court documents and evidence presented at trial, the physician received tens of thousands of dollars in illegal cash kickbacks and bribes in exchange for ordering laboratory tests, including expensive cancer genetic tests that were billed to Medicare by 2 related laboratories in New York. As part of the scheme, he authorized hundreds of cancer genetic tests for Medicare beneficiaries who attended COVID-19 testing events at assisted living facilities, adult daycare centers, and at a retirement community in 2020. The physician was not treating any of the patients who attended the testing events, and in many cases did not speak to nor examine the patients prior to ordering cancer genetic tests and other laboratory tests for them. He also billed Medicare for lengthy office visits that he never provided to these patients. Several Medicare patients for whom he ordered cancer genetic tests and billed for office visits testified at trial that they did not know who he was and had never met nor spoken to him. The physician did not contact the patients after the testing events to review the results of the cancer genetic tests, and in some cases, the patients never received the test results. In addition to this laboratory testing scheme, he also received illegal cash kickbacks and bribes from the owner of a durable medical equipment supply company in exchange for ordering medically unnecessary orthotic braces for Medicare and Medicaid beneficiaries. The evidence presented at trial showed him on an undercover video receiving a large sum of cash in exchange for signed prescriptions of orthotic braces. The medically unnecessary laboratory tests and orthotic braces that he ordered in exchange for illegal kickbacks and bribes caused Medicare to be billed more than $24 million. Medicare paid more than $2.1 million to the laboratories and the durable medical equipment supply company involved in the schemes. The physician was found guilty of 1 count of conspiracy to commit healthcare fraud, 6 counts of healthcare fraud, 1 count of conspiracy to defraud the United States and to pay, offer, receive, and solicit healthcare kickbacks, 1 count of conspiracy to defraud the United States and to receive and solicit healthcare kickbacks, and 1 count of solicitation of healthcare kickbacks. Following his conviction on the 10 counts, he was remanded to the custody of the United States Marshals Service. A federal district court judge will determine any sentence after considering the U.S. sentencing guidelines and other statutory factors. All right, late February saw a vice president of healthcare software and services company who pleads guilty to a $1 billion healthcare fraud conspiracy. A Kansas man pleaded guilty to operating an internet-based platform that generated false doctor's orders to defraud Medicare and other federal healthcare benefit programs of more than $1 billion. According to court documents, the man admitted that he and his co-conspirators targeted hundreds of thousands of Medicare beneficiaries to provide their personally identifiable information and agree to accept medically unnecessary orthotic braces, pain creams, and other items through misleading mailers, television advertisements, and calls from offshore call centers. He and his co-conspirators owned, controlled, and operated DMERX, an internet-based platform that generated false and fraudulent doctor's orders for orthotic braces, pain creams, and other items for these beneficiaries. As the vice president of the company that operated DMERX, he admitted that he offered to connect pharmacies, durable medical equipment suppliers, and marketers with telemedicine companies that would accept illegal kickbacks and bribes in exchange for signed doctor's orders that were transmitted using the DMERX platform. He and his co-conspirators received payments for coordinating these illegal kickback transactions and referring the completed doctor's orders to the DME suppliers, pharmacies, and telemarketers that paid for them. The fraudulent doctor's orders generated by DMERX falsely represented that a doctor had examined and treated the Medicare beneficiaries when, in reality, purported telemedicine companies paid doctors to sign those orders without regard to medical necessity and based only on a brief telephone call with the beneficiary, or sometimes no interaction with the beneficiary at all. The DME suppliers and pharmacies that paid illegal kickbacks in exchange for these doctors' orders generated through DMERX billed Medicare and other insurers more than $1 billion. Medicare and the insurers paid more than $360 million based on these false and fraudulent claims. He pleaded guilty to conspiracy to commit healthcare fraud and faces a maximum penalty of 10 years in prison. A sentencing hearing will be scheduled at a later date. A federal district court judge will determine any sentence after considering the U.S. sentencing guidelines and other statutory factors. Now, finally, let's spotlight on my last case, another one of my favorites. You guys all should know what it's about. Now, finally, this Ohio doctor agrees to pay $600,000 to settle False Claims Act allegations. An Ohio physician has agreed to pay the United States $600,000 plus contingent payments to resolve False Claims Act allegations that he submitted fraudulent Medicare claims related to electroacupuncture devices. This man is a doctor licensed in the state of Ohio who provided electrical nerve pulse stimulation services to patients in facilities across the state. From the years 2016 until 2018, he allegedly improperly billed Medicare for the application of percutaneous electrical nerve pulse stimulation devices, also called P-STIM devices, in an office setting. The P-STIM device is a device for treatment of a chronic pain that, pursuant to manufacturer's instructions, is affixed behind a patient's ear using an adhesive. Now, needles are inserted into the patient's ear and affixed using another adhesive. Once activated, the device then provides intermittent stimulation by electrical pulses. It is a single-use, battery-powered device designed to be worn for several days until its battery runs out, at which time the device is thrown away. The procedures allegedly did not involve any surgery, anesthesia, or take place in an operating room, or even at a facility which has such capabilities, but were instead billed to Medicare as surgically implanted neurostimulators, contrary to repeated guidance from the Centers for Medicare and Medicaid Services. And now it's time for my best practice tips in Trusty Tip. So, like I was saying at the beginning of the podcast, I have been auditing all sorts of chemotherapy, infusion, all sorts of drug claims for over 10 years now. Recently, I am auditing a lot of documentation regarding behavioral health, and this really comes to my mind. I need to talk about this in a podcast. I'm going to be speaking about it at a presentation. I'm going to write articles on it, but there's still a lot of misunderstanding on drug toxicity, drug therapy, how we can address it when it comes to our E&M types of codes, and that last column, that column 3 for risk for patient management. So I really hope this really small snippet will help some of my audience understand when to use it when it comes to factoring in patient management, right? So I wanted to go over some of the reminders on our E&M column of risk to patient management, right? I've been auditing these types of claims for a long time when it comes to the terms drug therapy requiring intensive monitoring for toxicity. That item alone scores as a high or a level 5 for that column of risk. So it can certainly be abused. In my mind, I've seen it being abused, because it's misunderstood when our providers are managing their patients. So let's go back to 2023 when there was a revision in the AMA guideline in our CPT codebook, right? When all of that new green text came out, there was new language that came out in 2021, but in 2023, the AMA revised the entire thing again. So I'm going to read it to you, because I think it's really, really clear what the intention is if you read this passage again and again and again. All right, so it says, quote, drug therapy requiring intensive monitoring for toxicity. A drug that requires intensive monitoring is a therapeutic agent that has the potential to cause serious morbidity or death. The monitoring is performed for assessment of these adverse effects and not primarily for assessment of therapeutic efficacy. The monitoring should be that which is generally accepted practice for the agent, but may be patient-specific in some cases. Intensive monitoring may be long-term or short-term. Long-term intensive monitoring is not performed less than quarterly. The monitoring may be performed with a laboratory test, a physiologic test, or imaging. Monitoring by history or examination does not qualify. The monitoring affects the level of MDM, the medical decision-making, in an encounter in which it is considered in the management of the patient. So again, it's in that encounter. That's when that management happens. An example may be monitoring for cytopenia in the use of an anti-neoplastic agent between dose cycles, Examples of monitoring that do not qualify include monitoring glucose levels during insulin therapy, as the primary reason is the therapeutic effect, unless, they give a caveat here, unless severe hypoglycemia is a current significant concern, or annual electrolytes and renal function for a patient on a diuretic, as the frequency does not meet the threshold, end quote. So I really love that new green text that we received in 2023 in our CPT code books, because they really do state that it's all about the documentation, right? And I see this time and time again in our EHRs when it is simply the same copy-pasted information that they, are bumping this up to a level 5, and the language is all copy-pasted, right? There is no specificity. There's no painting of an accurate medical picture for individual patients, right? It is just a copy and paste of this language that they are monitoring for toxicity. Well, what are you monitoring, right? There's no imaging. There's no labs being drawn. There is nothing evidenced in that particular date of encounter, like the AMA stresses within their guideline. So to me, this has always been very, very black and white. But over the years, I clearly have seen the misunderstanding from providers. So much more education needs to be provided because as I'm auditing, I have to dock that, right? Of course, there's a level of risk, but it will never be that level 5 for the monitoring of toxicity. So we have to keep in mind that at that particular junction, the provider would like it to be a level 5, right, for the monitoring of toxicity, but the documentation doesn't support it. So that level of risk is going to have to be lower than a level 5, right? It can be a 4, it can be a 3, it can be a 2, again, based on documentation. So lots of improvement that needs to still be performed here in 2025. So I really hope today's Trusty tip helps my audience understand that you really do have to showcase the fact that you are monitoring the toxicity of the various injectates that you are providing or infusions that you are providing for your patient population. I think that's the key to actually support a level 5 in that column 3 for risk to patient management. Okay. And now it's time to wrap up today's episode. I focus season 14 Spark on change. I want this 14th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone whose words provide us with insights and wisdom on change. So in this week's inspiring quote in Spark is from a wonderful artist I've always adored, Andy Warhol. They always say time changes things, but you actually have to change them yourself. So very true, right? That's one of my favorite quotes. This quote reminds us that we cannot remain complacent. This quote encourages us to stand up and be heard. This quote shows us that we have to do the work to make change happen. I'm happy Andy Warhol's spark still burns brightly and still inspires so many. All right, you guys, that wraps up today's episode. This month is ending in just a couple of days. So let me know what you guys have on the horizon for the month of March. I'm looking forward to some spring blooms, hopefully in March. Hopefully we'll see something. I'm excited. My snow is melting as I'm recording this episode, finally. All right, you guys, I wish you all an amazing and very, very happy week ahead. Thank you so much for tuning in, listening in on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.